So you have two hands, and the hand that's going to do the work, your finger is hooked, it goes round, and you can feel, especially if you've got someone with a lovely, long, elegant neck, but even people with strong, short necks, you can feel the bumps at the back of the neck, which are those dorsal spines. So you hook your finger around the dorsal spine, and it's this part of your finger there that's going to be where the work is done. And so if I hook this finger around, this hand just slides underneath and acts as a support. And then my hands are very, very relaxed and soft. I feel that my finger has hooked around the back of the spine, and then either, as I described, I lean my body back or I lean my elbows. I actually prefer leaning my elbows, and then all I do is a very gentle pull, and you can see the amount of movement that occurs. Now, is that painful? No. So that's the movement, and I'm moving maybe 5 to 7 millimeters, that's all. And make sure that your hand doesn't press on someone's ear, or just make sure that everything's very comfortable. Your hands are very, very soft, and the pressure is not a lot, but it's also soft and gentle. And as long as I am pulling in the direction of the facet joint, then there will be just that lovely glide, and I'm gliding the top facet on the bottom one. I'm gliding it towards me. And then what I do is I move up one level, and I do the same thing. And all you have to do is just 2 or 3 glides. So I do there, and I can feel, and again, is that sore? So it's very comfortable. And it's a very nice, the person you're treating should feel it as just a stretching feel.
Yeah, it is.
Yeah, it's nice, isn't it? And then I move up one level, and then up we go. So you work your way up the neck, doing just a few glides. When you get to the sore area, which you know from the symptoms, you go more carefully, you spend a bit more time, and you do some more glides, and you need to sometimes explore. So if this is where her pain is, which is way down, what I do is I find that I can only go maybe 2 or 3 millimeters, and then it's a bit sore. So then what we do is we relax, you breathe out, and as she breathes out, I just explore to do a little bit more. The other trick is that as you stretch it, when you reach your limit and you let go slowly, because what you're doing is you're stretching all the tissues, and then you're releasing them. And sometimes if everything's sensitive, if you release too quickly, you may get a spasm. So everything's done very gently, very slowly, hardly any effort. And you see, you can do this. I'm just doing a very little wobble, just to relax everything. But if my hands are relaxed, then your patient tends to be relaxed. Just like that. There. And then you release slowly. So that's the technique. That's called a neutral apophyseal glide. The apophysis is the name of the joint, the facet of the joint. Neutral means it's gliding along the plane of the joint.